Hi everyone, I am Dr. Shashikant Kulgod, surgical gastroenterologist and laparoscopic surgeon from Lakeview Goaves Hospital, Belagavi. Today I want to tell few things about one of the most important organ in our body, the liver. Liver is one of the important digestive organs in our body and most of you know about it. And one of the common problems with liver or common disease regarding liver is alcoholic liver disease. As all of us know, alcohol has become part of everyone's life or most people's life, or it's part of the society today. We cannot just wish it away. Alcohol is everywhere. Not everyone who drinks alcohol is an alcoholic. So there's a big difference between drinking alcohol occasionally or someone who is an alcoholic who is dependent on alcohol and he just can't live without that. Alcohol tends to cause major problems to the liver, those who overconsume it or get addicted to it. Liver cirrhosis is a end-stage liver disease due to alcohol abuse, and then it leads to multiple complications. Liver fails, and only treatment after the liver fails is liver transplant, which not everybody can afford it. So a lot of my patients, when they come and when they say that they are not able to stop taking alcohol and the family members want me to tell them, somehow convince this guy not to take alcohol, I generally tend to tell them a couple of things. Alcoholism is a disease. It needs help. It needs medical help to get rid of it. So, but then the patient has to make up his mind first that he wants to leave alcohol for his own health sake or for his family's health sake. Only after he makes up that mind can then the medical personnel, de-addiction centers can help this person to get rid of alcoholism. So one thing which I ask most of these people who are generally males who abuse alcohol, many of them in young age, many of them who own vehicles. So one question I ask these patients is, do you drive a vehicle? They say yes. Is this vehicle runs on petrol or diesel is my next question. And if they say it's a petrol vehicle that he has, I ask them what happens if you put diesel into this vehicle. And invariably every person knows that if you put a wrong fuel, the engine seizes. So they invariably tell that the engine seizes. So then I take it forward from there and tell these people that the human body is made by God and it tends to take a lot of abuse. Even if you put a wrong fuel, it tends to recover, unlike man-made machines. So our body cannot be abused. Alcohol is not the fuel for us and they should stop using that. Second thing which I ask these patients who are again youngsters in their 25s, 30s, 35s, how many children do you have? And invariably I get an answer, I have 2 children or 3 children, age 3, 6, 8, etc. So I gently ask them, what happens to them after you are not there? This generally tends to touch them and then they realize that they are doing something wrong and the family is dependent on them. Only after they realize these two things, that this person makes up his mind that he needs to stop alcohol altogether, then we guide them after treating their acute problems with alcohol abuse, whether it's jaundice or any other problems, we then guide them towards de-addiction centers or psychologists who help them to get rid of this alcohol. Thank you.